Coming of Age is coming up next. I'm your host, Emily Echevarria. First up today, we're introducing Baptist's newly opened emergency room and urgent care, what it offers when you need a visit. Next up, we're discussing elder law issues and the importance of long-term estate planning with attorney Jason Waddell. Lastly, we'll be talking with professional patient advocate Maria Vygotsky about the challenges of navigating the healthcare system and when an advocate may be necessary. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Baptist Healthcare recently opened up its emergency room and urgent care facility on 9 Mile Road. It can sometimes be confusing trying to decide whether you or a loved one needs emergent care or urgent care. From fevers to fractures, Baptist has you covered with on-site imaging and labs so you can feel better faster, and they only bill for the services you need. Here to talk more about this new ER and urgent care is Christy George, Program Director. Thank you for joining us today.
Hi, thank you for having me.
So, how does the emergency room and urgent care facility work?
So that's a very common question that we get asked. People assume that there's an emergency room and an urgent care, different buildings once you come inside the main door. That's not necessarily the case. We are an emergency room that offers courtesy urgent care billing based on the level of care you receive. So for example, if you just have, say, regular cold symptoms, you might get a flu swab, a COVID swab, and you will just receive an urgent care bill at the end of your visit. Whereas if you come in with something a little more acute, abdominal pain, chest pain, something like that, that requires lab work and advanced lab work and imaging, then you would receive an emergency room bill.
Okay, so it's all one building, one facility.
Yes.
Gotcha.
Yes.
So what are the hours of the new facility?
So because we're an emergency room, we're open 24 hours a day, 7 days a week. But the courtesy urgent care billing hours are between the hours of 7 a.m. and 8 p.m. 7 days a week. And that includes holidays. I think there's 1 or 2 holidays that are not included, but it's 7 days a week.
Okay. So do you take appointments?
We do not. Walk-in only. However, we are very diligent in trying to move people through the facility quickly, especially we focus on the urgent care patients as far as getting them in timely, because I know most people think, urgent care visit's going to be super quick in and out, and so we try to really stick with that, even though we are simultaneously treating them more acute level of care patients.
Interesting. Can you do the routine blood work that a primary doctor would order?
So if your primary care doctor orders lab work, that typically should be done at an outpatient drawing station. And there is one actually connected in the same building where we are. So we would do blood work if you see our provider and they order blood work for you that they feel like is acute that you need emergently. Those labs we do in-house, but otherwise the outpatient lab draw station there is happy to do that for you.
So it's not like those annual labs you're doing with your primary care?
Correct.
Gotcha. So what type of services do you offer in the facility?
We offer everything you can imagine that an regular ER would have. We can do respiratory testing, we can do advanced lab work, we can do CAT scans, ultrasound, x-rays, everything that a regular ER would offer, we do the same.
Gotcha. And what insurances do you accept? I'm sure a lot of people are wondering about that.
Yeah, all commercial insurance and including Medicare and Medicaid.
Perfect. So what happens, someone comes in, they have an emergent case, and they need to be admitted to the hospital. How does that work?
So our provider will, assess the patient. If they determine based on their examination that the patient needs to be admitted, they will contact the admitting physician typically from our facility, we're going to go to either the Maine Baptist Hospital inpatient or Gulf Breeze Hospital inpatient. So they will contact that physician will accept the patient, and then we will have a bed assigned, and then we will arrange your transport to go over to be admitted. We take care of all of that for you.
Okay, awesome. And why should the public choose this facility?
Well, Baptist is well known, has an excellent reputation. They've been around for over 70 years here in Pensacola, so they are well known for giving exceptional medical care. So first and foremost, it's the Baptist name that should, ring a bell to people when they're wondering where to go. But what makes this facility unique is it takes the guesswork out of the public in having to choose where they need to go. They don't have to decide, is this urgent care or should I go to the ER? We are capable of handling both. Everything is appropriate to come to us. If you think that you are just having something that could be urgent care level and it turns out that you'd really need a little more advanced care, we're able to handle that without sending you to another facility for that.
Yeah, we were talking about how, I have a child. A lot of parents will have a kid that's sick and you're not quite sure, is this something we need to go to the emergency room, or do we need to kind of, maybe if it's in the middle of the night, wait and go to urgent care? And this kind of takes that questioning out.
Takes the guesswork out of it. And then the other huge benefit to the community is the cost savings, because we can do everything in-house, but getting an urgent care bill versus an ER bill for, say, an ear infection in a child could be the difference of, $2,500 and $250. So it's a huge cost savings for the community.
Absolutely. Will the patient know when they're there at their appointment whether they're getting kind of urgent care or ER care? Will they know what they're going to be billed for?
So we are very transparent in that. If the provider sees you and determines that you need the advanced blood work or you need a CT scan or an ultrasound, we will come to you and bring what we call an ER acknowledgement, so that you are made aware that you are now going to be actually in an ER level visit for billing purposes. And so you sign it, and then we handle the other thing on the back end.
Excellent. So tell me again the location of the ER and urgent care facility. I know there's more than one.
Yes, we actually have two. So our newest one is at 9400 University Parkway. It's in the Baptist Medical Park that's been there for many years. And we are actually in the facility that was previously a Baptist urgent care. We've just come in and sort of revamped it a little bit so that we can, do emergency services there as well. And then our other location, which has been open for a little over 3 years, is in Navarre, and it's at 8888 Navarre Parkway, also in an existing Baptist medical park.
Okay, great. Anything else people should know about the ER and urgent care facilities that Baptist has?
We are there. We are ready to take care of your family, and no one wants to have a medical emergency or a medical illness, and I know how difficult it is to get in with your primary care doctors sometimes, but we are there 24 hours a day, ready to take care of you.
Awesome. Well, thank you so much for being here.
You're welcome. Thank you.
Coming up, I'd like to speak with a lawyer. We're talking elder law issues next. Stay with us.
It's important to get a flu shot each and every year because flu viruses are constantly changing and immunity from the vaccine decreases over time. Flu vaccines are updated annually to work against that year's viruses. The best time to get your shot is in the fall, but getting it later can still help. Getting a flu shot lowers your risk of getting sick, and if you do happen to get flu, it's likely to be less severe.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
Long-term care and estate planning can be daunting even in the best of times, but it's important to tackle this task early so that plans are in place when they're needed most. Here to tell us more about what's involved in long-term care planning and why it's important is board-certified elder care law attorney Jason Waddell. Thank you for being with us today.
Thank you for having me.
So first, tell us a little bit about yourself and how you got into elder law.
Well, I've been in Pensacola now for a little over 22 years, I believe. And I got into elder law after coming here with a focus of estate and gift tax. And when I got to Pensacola, I found there were a lot of good tax attorneys, but there weren't very many elder law attorneys. The planning is very similar in the fact that we're typically dealing with people's estates, their families, and trying to keep it all afloat. My other focus had been in alternative dispute resolution in law school, which also fits well into this because we're working from today to the date of death, whereas your tax attorneys are usually focused on what happens at time of death. Mm-hmm. So it was a pretty easy transition over, and I've been doing it ever since.
So what is typically involved in long-term care planning?
Long-term care planning is where we're looking at today, and we're forecasting out to see what's coming. And that could, based on when we start with the planning process, could encompass what we call the healthy years of retirement into what people may experience when they're sick, or a lot of times it's when somebody has an illness that's been diagnosed, such as early Alzheimer's or dementia diagnosis, and now we need to start being a little more proactive with our planning and looking at assets. We're looking at who's going to be able to make decisions if they're not able to any longer, where they'd like to live, and just trying to get a better feel for what is their goals are, because everybody's different.
So tell us why that type of planning is so important.
It's important because if they don't do it ahead of time, then it leaves everybody else to guess. And it can oftentimes domino into where we're in court proceedings that we'd like to avoid. A lot of people have heard of guardianship, and that's where the state comes in, has the person declared incapacitated, and then appoints somebody to be the guardian. Courts having to act in a very short period of time. And so it's hard for them to get the full picture. So if we know what the person wanted ahead of time, then we can better make decisions that are in line with their goals, not with what other people put on them.
Absolutely. At what age should you start organizing your assets?
I joke that people need to start as soon as they have assets. So, I tell my son, he's 17, you need to get on with it. But ideally, from my standpoint, with more of an elder law, I'd like to get people 5 years out from retirement so that we can be sort of following up with what their financial planners are telling them from more of an elder law aspect, because we see a lot of the costs and expenses. Most retirement planners want to talk about the fun things, the trips, let's go to Italy, overseas, wherever. Whereas I'm going to be focused on, yes, we want to accomplish all that, but what happens if things get sideways, and we look at the financing from there. But really, there's no age that defines it, because a lot of people at 65 act a lot more like some 95-year-olds I know, and some people in their 90s still act like they're in their 50s.
Sure, a lot of variance with that. So with constant changes in technology and more of our lives being online, what should older adults be aware of or avoid when they're organizing their assets?
It's a really good question, because it's something that we're seeing more and more people. As the baby boomers hit retirement, they're more comfortable with technology than prior generations. So that idea that retirees don't get on the internet, that's just a false narrative. They do. But we have things that are coming online now that are new scams that they need to be aware of, such as the phishing scams with emails. They've been around for a long time, where if you get an email that's a joke, but it's been forwarded and forwarded and forwarded, it's not a real good email to open. You don't want to stay on those. And social media, where they're asking for permissions to access your personal information, you should probably avoid that. Stay with people you know, people you trust. And that can be carried out into other aspects as well, such as people who call you. If you don't know that person and you don't know that number, then you should always just hang up and call back. So if it's your bank and it's the fraud department, when you call your bank, they're going to route you really fast back to the fraud department. You don't have to talk to that person calling. The government's not going to call, nor are they going to ask for gift cards, which is, for most people, it's sort of common sense. Nobody's going to ask for a gift card to pay a debt, but it happens every day, and we're seeing more and more people get scammed that way. And then there's romance scams where they're getting people to agree to relationships and all of that. But the big takeaway I'd like for people to be aware of is if something happens and your accounts are hacked or somebody gets access, you need to report it. Don't be afraid to do it. That's one of the reasons the retirees are one of the more targeted groups, because of fear that if they report this, now everybody's going to assume they can't handle their affairs. And that's just simply not true. Mm-hmm. Home Depot, Microsoft, Target, they've all been hacked. These are billion-dollar companies, and they can't stop it. So just the fact that you have trouble in and of itself doesn't mean that you can't handle your affairs. So we want people to be aware. Just use some common sense things, deal with people you know, and you'll be okay.
Yeah, and these scams, the scammers never sleep. They're constantly evolving. I mean, with the scam where you see your own bank's fraud department number come up, yeah, it's hang up and call back, because they are just, taking the phone number and like making it look like it's coming from there. It is wild. There have been some changes in tax laws recently. Can you tell us a little bit about how those changes will impact estate planning?
Yeah. So the big one that happened, it started in 2019, but then got updated this past year. It's called the Secured Act. What this did was it modified how our retirement accounts, like IRAs, work. Where used to you had to be 70 and a half, and then you had to start taking required mandatory distributions out each year. That number has now been pushed out to age 73, which for some people they're like, yeah, I don't want to be taking distributions off. From my standpoint, it was somewhat of a negative, because the backlash or the cost that nobody talked about is now when you pass away, you leave that IRA to your children. They no longer can stretch out the payments over their lifetime. They have to draw it out within 10 years. And so with people retiring now with a lot of times large IRAs, there may be $750,000, there may be $1 million or more in this IRA. If they die and their children get that, and then they have to take it over 10 years, they may be losing 25% of the value. So we really have to adjust that. Now, there are exceptions. If we have special needs children, a spouse, things of that nature, we can adjust for that. But it has shifted how we address that in retirement, because now, whereas we used to would push an IRA off and not utilize it, now we are when we have higher medical bills, because we can take the income and we can use the write-off for medical expenses so we don't get beat up on taxes. So laws change, we just adjust strategies. That's it.
So what's the best piece of advice you can give our viewers about planning for their long care needs?
The best piece of advice I can give is know the people in your circle of influence, and those are the interested people, and that's what I call the good, the bad, and the ugly, which, the family member who's always stirring the pot, a special needs child that doesn't need to be in charge of anything, but they're important to be included, the distant family member that you want to be able to take care of, your immediate family, friends, things like that. And then your assets. Know what you have. It's amazing to me how many people will come into my office and they can't tell me what they own and where it's at. Such as, I have a life insurance policy, but I don't know where it's at. They need to know where those are. Then the people they trust, and then what do they want to happen? What goals do they have? That gives us the ability to be able to help them accomplish that.
So that's that basic information that people need when they're starting that process.
Yes.
Great. Well, thank you so much for sharing this with us today.
Yes, thank you for having me.
Stay tuned. We're discussing the work of a local patient advocate next.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Navigating the healthcare system after a challenging diagnosis for ourselves or a loved one can be difficult and scary, and it's often something that must be dealt with unexpectedly. That's where a patient advocate comes in. We're talking with professional patient advocate Maria Vygotsky about this role and who might benefit from having one in their corner. Thank you for being here to talk to us about this.
Well, thank you, it's an honor.
So what is a patient advocate and what inspired you to get started in this field?
So a patient advocate really can be all of us. It's a family member, a friend, a neighbor, a coworker. Maybe it's a caregiver through Council on Aging, hired professional like myself, but it's someone who either has the expertise or the confidence to be able to speak up for you, to ask questions, gather information, find resources, anything that's going to take away some of the stress and overwhelm you might be experiencing, and ensuring that you're getting good quality care, that you're able to make informed, educated healthcare decisions. And I got into it. My parents started having health issues. My mom was diagnosed with stage 4 pancreatic cancer. My father had 2 brain bleeds and needed emergency brain surgery, and then short time after was diagnosed with lung disease. And I saw for the first time a different perspective in healthcare. I'd been in healthcare for 27 years, and I saw patients that didn't complain. I was so used to being over patient experience, working with patients who use their voice, and we worked out the issues, and I assumed every other patient probably had great healthcare. But I was seeing patients that weren't going to speak up, that thought healthcare was going to look out for their best interests. And we have wonderful doctors and nurses in healthcare. We have wonderful treatment plans, but it's a very complex system that's fragmented and broken. And so sometimes those that aren't speaking up, that are so vulnerable, aren't getting the care that they need. And that's what just ignited a passion in me to start an advocacy business.
Okay. Well, how do you identify those that would most benefit from having a patient advocate?
I think anyone that's overwhelmed with their health care or it's beyond their expertise. The Joint Commission, which is the gold standard in healthcare accreditation, they accredit over 22,000 healthcare facilities in the country. All 3 hospitals here in Pensacola have basically said every patient needs an advocate by their bedside, someone that's going to help guard against one of the many mishaps that from medical errors that lead to preventable deaths. So it's really important, whether in the hospital or outside, if you need some help with your health care, to reach out to an advocate.
Absolutely. Well, can you walk me through the typical process of working with a patient from the initial contact to the resolution of their healthcare concerns?
Mm-hmm. So most patients just Google and find a patient advocate. There's wonderful healthcare platforms now, Solace Health, GNA, Umbra. They can look at patient advocate profiles and set up, most of the time it's a complimentary call. And I'd say about 75% of my patients, they don't end up, or my prospective patients don't end up hiring me, but I'm able through that call just to give them the resources that they need, the support, the confirmation of what they're doing, or some suggestions, so they feel comfortable going forward with our health care. Now the ones that do need the help, they come up with their goals, and then we work on an action plan together. And because I have the experience in healthcare, I know the who, what, when, where, how. It doesn't matter what state they live in. I'm very comfortable navigating the systems. And so we move forward until there's resolution, and hopefully they get the care that they desire.
I know sometimes it's just knowing what questions to ask. You're getting all this information, you're scribbling down notes, but knowing what kind of follow-up questions or what kind of options might even be out there that you wouldn't know about. You don't know what you don't know. So I can see where an advocate would be really necessary.
Mm-hmm. And when you're experiencing health issues, you don't have the same clarity. The stress, kicks in, and so it's important to have someone that can be more objective.
Absolutely, and that's why sometimes a caregiver maybe is in a emotionally fraught position when they're being the advocate for that patient as well.
Right.
So what tips or resources can you share to help patients or caregivers as they navigate the challenging medical systems?
Well, health is our most valuable asset, and so it's really close to home. It's very personal when it's your health or your loved ones. But when you go to see your provider, it's a short window of time that you have. So as much as possible, take the emotion out of it, and instead present facts, objective information, what your symptoms are, what's working, what's not, because again, you only have a tiny window of time with that doctor. If you get lost in the stories and the emotions and what's happening, you're not going to get the doctor's full expertise to help you. And a good resource, I love this. Medicare came out last month with a new program, and I believe the only requirement is that you have to be on Medicare, so it's not financially based. And I'm working a couple of the cases now. But you can ask for a community health worker, which is just like a patient advocate, and they're there to be a liaison between you and the community and you and your healthcare team. You still retain full control of your medical decisions, but they're only there to support you. You don't pay anything, and they're able to help you with your medical. And with a huge growing population of 65 plus in our nation, and a third of them living alone, this is going to be really important that they have this support. So if anyone needs information, they can reach out to me about it.
That's awesome. That's a great program to have. Yeah. So can you share a specific example from your experience where patient advocacy made a significant difference in someone's healthcare journey?
Sure, I'll pick an out of state just because of confidentiality, but I recently had a 78-year-old who had a fractured toe, and she fell at home because she had a boot on, she wasn't used to walking in, and then injured her back and needed a back procedure. The surgeon wanted her to get stronger before doing that, and because she lived alone, recommended short-term rehab in a nursing home. The son, who lived out of state, reached out to me, asked me to help her find a place. I did. Gave her options. She selected the one and then got settled in the nursing home. She said everything was great, and so I said, well, I'll keep the case open in case you need anything. 3 days later, the son calls. It's been 4 days with no rehab, and that's why she was there. And this is not uncommon. This happens in Pensacola, everywhere. So it was a Sunday afternoon. I was on the phone to the charge nurse, found out what had happened, had a backup to the backup come in to see her that evening. And the next day, of course, we had apologies, and from there on out, she was able to get the rehab she needed. But sometimes it's just that extra person, again, knowing who to call, what to do when these mistakes happen, because they are going to happen.
Exactly. It's just such a complicated system, and there's so many moving parts. So having someone that just knows how to navigate it is priceless. Well, thank you so much for being here.
Thanks for having me.
And thank you for watching. Until next time, enjoy life. You've earned it.